Hi, welcome to Basic Mental Health. Why my students are calling me Mr. International? Because I provide very basic lectures, very basic information. So today, let us talk about how you can define mania, the signs and symptoms, and the factors which can contribute for a person to have mania. A lot of students make mistakes because they think that writing the exams is about writing the essays. No. In the exams, you as a person, you must be able to capture basic information. So like for me, when a question is asking you to define mania, to define depression, to define schizophrenia, the definition in the exams are supposed to attract free marks because you are the person who has been studying for 3 years, and I don't expect you to struggle when it comes to define these conditions. Then number two, I don't expect a student to struggle when it comes to state the signs and symptoms of mania, depression, and the schizophrenia, because the signs and symptoms of these conditions, they attract 15%, and it's very possible that you as a student to get all those marks. Then number three, factors which can contribute for a person to have mania, to have depression, to have schizophrenia. That is 30 marks. And for me, these are what we call free marks, marks in the pocket. So when you pocket the definition, when you pocket the signs and symptoms, and when you pocket the factors which can contribute for a person to have mental condition, forget about failing in mental health. You understand? Yes. So now, let us look at mania, and that is the definition, signs and symptoms, and causes. You understand? Yeah? So one, what is mania? Mania, first of all, when you are defining it, don't generalize. No. Because mania belongs to a group of mental disorders which are called mood disorders, or bipolar disorders, or affective disorders. So you start by saying mania is a mood disorder which is characterized by elated mood, pressure of speech, and grandiosity for the period of at least 7 days. Because to define a mental health condition in psychiatry, it is to make it unique. And I can guarantee you to say in psychiatry, there is no any other condition with a similar definition. Understand? So if you define mania in this way, it means in the exams, you are going to attract 5 out of 5. Another question will come on you to say, state the signs and symptoms of mania. Guys, to state is to explain briefly. It's not to give reasons. You say due to, you just be struggling, you just be stressing yourself. Understand? Yeah? So the symptoms of mania can be remembered to say a person who has got mania will present with elated mood, with what we call dig fast symptoms. And now, what are these dig fast symptoms? One, D, distractibility. So here, the patient will easily pay attention to every environmental stimuli. Number two, D, I, impulsivity. That means this person with mania will engage into activities without considering the consequences, or will engage into dangerous behaviors without regarding the consequences. Then G, grandiosity. Those people with mania, they will present with exaggeration of self-importance, or maybe they will present with delusions of grandiosity, where they believe that they have got supernatural powers. Dig fast. F, flight of ideas. So these people with mania, they will present with flight of ideas. That means during conversation, they can jump from topic to topic. Understand? First, A, psychomotor acceleration for A. Psychomotor acceleration. And that means those people with mania will present with increased psychomotor activities, or they will present with restlessness. Then S, reduced sleeping patterns. So these people with mania, they will present with a decreased need for sleep. That means they will sleep very little and feel very energetic. Then T, talkativeness. That means these people with mania, when they are talking, they will be talking on top of their voices. You understand? Dig fast. So those who are in the examination never should you forget dig first symptoms. Like for me, when students fail the exams, I don't understand how. Because when the question comes the exam and that question is involving a condition, that means it is very simple for you to pass a particular exam. Then from there, we can also come to schizophrenia. Schizophrenia. So in the exams, when the question comes involving schizophrenia, you should never miss its definition. Because when you miss its definition, it's suicide. It's suicide. Then, so says schizophrenia, we don't just generalize, no. Schizophrenia belongs to a group of mental disorders which they are called the functional psychosis, and therefore in the definition we say schizophrenia is a functional psychotic disorder characterized by delusions, hallucinations, and disorganized behavior for the period of at least 6 months. I told you to say, when you are defining a condition, you have to make it unique. When you are defining a condition, you have to make it unique. You don't just generalize. You people, you are academicians. Don't define as if you are coming from the street or maybe you are presenting on the radio station. No. So schizophrenia is a functional psychotic disorder which is characterized by delusions, hallucinations, and disorganized behavior for the period of at least 6 months. Why are we emphasizing to say for the period of at least six months? There are some conditions which look like schizophrenia, but because of the duration of the symptoms, they are not schizophrenic conditions like brief psychosis, schizophreniform disorder, drug-induced psychosis, schizoaffective, HIV-induced psychosis, delusional disorder, paraphrenia, all those factors. Are we there? So when the question is asking to say, state the signs and symptoms of schizophrenia, just remember the word HDBS network. HDBS network. Understand? H for hallucinations, where the patients will present with perception in the absence of external stimulus. Delusions, where the patient will present with false and fixed beliefs, which cannot be scientifically proven. And also disorganized behavior. The patient will behave in an appropriate manner, or like undressing in public, eating feces, and also disorganized speech. The patient will present with a speech which is very incoherent, and any negative symptoms. The patient will also present with negative symptoms such as alogia, where they will present with poverty of speech, and also ambivalence, whereby they will present with coexisting opposite mixed feelings, and also evolution, where the patient will present with a lack of motivation, asociality, where the patient will present with absence of social interaction. Yes. Then from there we go to depression. Remember, we are talking about the definition and signs of symptoms. So these in the exams, if you know the definition, if you know the signs and symptoms, you are guaranteed to have 20 marks for free. You understand? Those we call them marks in the pocket. Then from there, depression. Depression belongs to a group of mental disorders which are called mood disorders. Mania is a mood disorder. Depression is a mood disorder. Or mania is a bipolar disorder. And depression is a bipolar disorder. And when it comes to definition, don't generalize. You say depression is a mood disorder in which the patient will present with low mood, reduced energy, and loss of interest in the previous pleasurable activities for the period of at least 14 days. That is depression. You understand? To define a condition, it is to make it unique. You don't generalize. You guys, you are academicians. And when it comes to defining, you have to define it in an academic way. Don't generalize. Whatever you have seen on the Facebook, I don't care. So we are saying the signs and the symptoms of depression, they are low mood, whereby the patient will present with a very sad mood, and also SIGECAPS symptoms. Yes, this person with depression, they will present with disturbed sleeping patterns. That means they will either sleep too much or they will sleep very little. Loss of interest. So these people will present with loss of interest in the previous pleasurable activity. G, guiltiness. These people, they will present with delusions of guiltiness, whereby they will believe that they have committed unforgivable sins. E, energy. So these people, they will present with low energy. That means when they just walk for a short distance, they will feel extremely fatigued. So SIGECAPS, concentration. So these people with depression, they will present with poor concentration to things which require mental activities. Appetite or attention, I don't care. Appetite. So these people, they will present with the disturbed appetite. That means they will either eat too much or they will eat very little. SIGECAPS. CAPS. Then P, psychomotor retardation. So these people, they will present with decreased psychomotor activities. Then S, suicidal ideation. These people will always think of killing themselves. So please follow my channel. It is written mental health basic lectures. I'm also on YouTube. You can also follow me on the Facebook. It's me, Mr. Potfa, Mr. International.